My journey with CLL started in 2013, late 2013. I went to a routine physical appointment, and at the end of the appointment, I was asked to come back in, and she said that the doctor said that they had found that I had leukemia. So that got it. That's how it started, and from there they sent me to a specialist in that area, and so we went to the specialist and confirmed that I did have CLL, and basically at that point he told me that there was nothing that they could do.
Mm-hmm.
So that's how my journey began, and then I sought out different places that I could go to get talked to and counseled on, and see how I was going to proceed.
What did you find, or where did you look to go for, find resources about CLL treatment? How did you educate yourself?
Well, first I Googled it.
Mm-hmm.
So I could know what it was, and because in my mind I had heard, coming up, leukemia. I mean, that was a very, very, very scary word.
Yeah.
And I just thought it was a death sentence. Mm-hmm. So then Googling it, and then I found out that it was chronic. I was at a chronic state, not an acute state. So got some hope from that. And then a friend of mine recommended Seattle Cancer Care Alliance. So that's when I went there, and then I got pretty much all the education I needed from them, from Dr. Shadman and some of the nurses, and felt like this is something that may be manageable, potentially. So that's when the hope came in right there too.
Mm-hmm.
But yeah.
What motivates you to share your story?
What motivates me to share my story is I believe that cancer, and probably most types of cancer, when people hear them, they want to kind of go into a shell. They don't really want to talk that much about it, because they don't want it to kind of, in my circles, people don't like to own things. So it's kind of like, by talking about it, it's a stigma, like you're owning the cancer.
Mm-hmm.
And for me, I want to not only own it, but defeat it through whatever means there are, whether it's a clinical trial or whether it's prayer or whatever. So I like to share my story because I think other people need to hear more positivity about trials and different things, and what we can do, and feel like they can actually survive, and thrive while going through their journey. So mainly it's to inspire other people,
and so being, that it is September, what does Blood Cancer Awareness Month mean to you?
For me, it means a time that we can get the message out to people, and get them more aware of what's going on with cancer out there, and find ways that we can all contribute, and hopefully we can get more research through awareness. More people being aware, more people contributing, and in hopes that we can someday cure it.
Really interested. How was that when the doctor mentioned a clinical trial for the first time? What went through both your heads?
When the doctor mentioned clinical trial the first time, I thought, no, not me, you know. But that was early on in my diagnosis, and it was before I actually needed treatment. So as it got closer to needing treatment, I saw it more as an option.
Mm-hmm.
And then, like I said earlier, once my wife said, "Hey, you know, you're not feeling well, you're not doing well. What do you have to lose to do this?" To get into the trial. And then once I made up my mind, it kind of like just clicked, like, okay, get in the trial. And then I felt good about it. You know, the day that I went to start the trial, I was nervous, you know, and but I was also hopeful that the medicine would start doing work, and then I could start feeling better. So that, you know, wanting that and hoping to feel better and to get better overpowered my fear of uh, getting into the trial itself. Hope became bigger than fear at that point for me.
That's great. So in the end, how would you say the clinical trials provide opportunities for blood cancer patients?
I think they provide an opportunity for you to get in, not only help yourself, but help someone else. And that was the other part of it was, you know, this is going to help someone else. So it's not only about you. So, and then of course, when they work, I mean, that's icing on the cake. I mean, but it's a lot of work to be in a clinical trial because you have to record everything. So you have to be willing to put in the time and to do exactly what you're asked. But it's an opportunity to maybe make history and help yourself and others. That's the, you know, and once I started looking at it like that, then it just got bigger. I was actually glad to be a part of the trial.
Yeah. That actually leads to my next question. What was the most difficult about being in a clinical trial?
The most difficult, I think, is just making the decision to get in it.
Yeah.
For me, I'm the type that once I get in, I put in 100%. So, you know, whether it's taking all the notes of what's happening with me and taking the medications and on time and writing them down, all those things that you have to do, and making sure that you're at every, you know, appointment and following what the doctor says. Those are all big challenges, but it's gratifying when you get in and get through it.
I think when you're a patient, before you get in a trial or when you're not feeling good, a trial is like taking care of yourself is like another job. It's like a full job taking care of yourself, that you have to be willing to do it and acknowledge that you need to get better. You know, you can't ignore it. You've got to actually get better. And that takes a lot of time, and it's it literally is another job other than the one that you actually have that makes money for you, to actually take care of yourself. That's why I think a lot of people that are retired say, I didn't realize it was going to be a full-time job taking care of myself, because it is if you're ailing in some way.
And you as a caregiver, how was it? Was that, you know, how was that experience with the clinical trial? Because you say as a patient, you need to take care of yourself, but you were with Ken every step of the way, right?
Yes. I wouldn't really consider myself his caregiver, though, really, in that sense, because he's the one that did all the work. He's the one that did all the recording of everything that was going on, and remembering to take his medications and going to get the medications and, you know, the blood work and all that stuff. So,
She's
but-
not giving herself enough credit. Okay, so when I got diagnosed, I had to change how I ate. She's cooked for me all those years, the type of food that I needed and I asked for. And she's taken care of me that way. She's been to many appointments with me. She's even been with me twice when I was getting the bone marrow.
And I fainted.
She fainted in one of them. So she's been there, just not giving herself enough credit. She is a caregiver, and you need that around you in order to thrive in all, going through all this. You need that. You need that caregiver or that person there to, and hear your pain, hear what you're going through, and listen. And she's been there for all that.
Right.
Yeah.
If you were talking to a patient who's newly diagnosed with CLL, what would you tell them? What do you wish you would have known at the time when you were diagnosed?
You just need to listen to the doctors. You need to study up on it. You need to pray however you pray. But you need to understand this is a process. This is like day one. Things are going to get better. You just have to hang in there. And I would also tell them, I know that it's, you hear this and now it might not sound like what you want. It might not be what you need, but it's truly what you need. You need to be patient and hopeful, prayerful, and let the doctors, do their jobs and tell you how they can help you.
What would be something you'd be telling people who are working in blood cancer development, such as, BeiGene, but not limited, of course? What is something you would want us to know?
Ooh, that's a good question. I would want you to know that, first of all, patients appreciate what you guys do, because without cures wouldn't be coming. So we appreciate it. Secondly, I would just say, like any other thing, if you're going to get good results, you got to work hard and you got to be very involved and focused in what you do. And obviously you guys are dealing with people's lives. And I think that just staying focused and have some care and some love in there, and a little bit of enjoyment while you guys are, I know you're scientists and all this, but you got to enjoy life a little bit too.